So hello everybody. First and all, happy New Year. So we have nice case today. I want to share with you because there was lot of time that we didn't do it any kind of transmission regarding how to manage gastric varices. So today we have a 55 years old woman with a segmental portal hypertension. So so this patient was sent to us because of gastric varice, and now I am using a linear US from Pentax Medical. So this is the J10UT series. It's a therapeutic scope. So I'm trying to looking for the varices, okay, and this is very important. This is like the first step, and the first step that I want to use always is to use water to see the fundus very well. You can see very well here. You can see a lot of varices here, and this is our gastric varice, right? So it's here. So we have I am trying to see and to follow up these varices. So I believe there is one component coming from the left side of your screen. So I am using now the e-flow mode. You can see here very well. So what I am trying to looking for is what is the best strategy here. So until now, you know, the therapeutic approach for this kind of lesions is, you know, the gold standard technique is upper endoscopy with cyanochelate injection, but nowadays we have this technique that has shown it in a lot of meta-analysis that is superior to the standard technique using the upper GI. So why is this important? Because at endoscopy I just saw one gastric varice, but on US I see two package. One is here, right? So I want to say hello to my good friend Daniela. Brian is missing you a lot. I don't know why. So I hope that you hear that. So you can see here, this is the first package, and the second package is in this side. So I have to do a double treatment, right? So I will start to do my treatment here in this area, but I need to see where I need to follow the vessels because I need to see where is the feeder vessel here, right? I think it's here. I think it's here. So I will make my attack here first. I will do just koi here. Dame la aguja, por favor. So I will use a 19 gauge needle. I will do a varicellography that we described in 2019. I think it's very important and interesting overall, you know, we are using this. I want to say thank you to my good friends from Boston Scientific. Always, you know, Sylvia, Mike, thank you a lot. I am using now a standard needle, 19 gauge from Boston Scientific. And now I'm trying to looking for my vessels. So this is the splenic vessels. So now I am perfect. This is very important to be in a good position and to achieve the target. In this case, this is my target, right? So now I will try to see if I am inside. I'm not inside. And sometimes it's not easy, as you can see here, right? Very difficult, huh? Maybe I am inside. Yes, I'm inside now. Okay, now. So I see the blood, you see here, right? So now I am inside. It's a little bit difficult, huh? So now I will flush with saline solution. It's not a good point, you see? So I will try to see other. Other vessel. This case is not easy, huh? I'm just there. Try to find out a little bit. Now I'm inside again. I think I am better now. So now I will flush. You see, now I am good. Now I am fine. Now I want contrast. I want to see if there is any shunt. Contrast. La fluoroscopía en grande, por favor. So you can see there is no shunt. That's very good. Perfect. So now I will put one coil of 10 millimeter. And that's all. And then I will go to the other vessel, because the other vessel is the bigger one that we see by endoscopy, by upper endoscopy. Este es de 10. So one of 10 millimeter because this is a small vessel, right? This is an isolated gastric varices, right? So that's why I will put just one coil, and that's all. So now I will remove. I will see, and now it's okay. You see? So now I need to go to the other side. That is this vessel here. I'm going here. Okay, voy a aspirar. I will make an aspiration just to be sure. No. So I'm almost sure that I'm inside, huh? So weird. So I can see my needle inside, but probably I am just in the wall, and I didn't pass through. So now I pass. I feel it, And now I'm trying to recover my position now. No. Okay, now I am inside. Aquí. It moved too much. I will take it here. ¿Sabes qué? Purguémosla. I will make a purge. I will pass saline. Ok. Ahora sí, aspiración. Ten ahí. No la abras. So these cases are difficult sometimes, huh? Because it's not like similar to portal hypertension due to liver cirrhosis. The way to be is a little bit different sometimes. The mechanism is different, and also the response to the treatment is different also, right? No. So you need to remember that we are looking in 2D, and that is why in the future 3D reconstruction image will help us to be in a correct place when we are doing this kind of treatment. Now I am inside. Okay, dame salina. But you see, I am not inside the feeder vessel. So that's very important. This is very important to understand. When you are inside the feeder vessel or not. When you are inside the feeder vessel, so normally you have a diffusion of the saline solution when you make the flush. Correct? Dame salina. So now I am inside again. When we make a flush. Now it's going. Now I am okay. So now I want to see contrast. And I want to see if I am in a good position, right? I am not. I am outside. Incredible. Let's make an aspiration. Aspiración. Now I am fine again, but the movement of the patient is very high. So, so now we pass saline solution. I'm not sure. Dame contraste. I'm not so sure. So I am inside again. You see? Okay, Salina. Dame un coil de 10. I will put another coil of 10. Okay. Okay. Now I am fine. Retira. And I will try other place just to dame para aspirar. So I am inside again. Dame salina. Okay. Here. Ok, aspiremos. Espérate. Yeah. So I'm inside again, and will be my last coil. Dame un poquito de salina. Dame salina primero. Aspiremos. Quiero aspirar. Ajá. So sometimes we need to play with the movement. I'm trying to go inside. I believe I am inside, but you know, with the movement It's difficult. Dame salina. Dame contraste. No. A little tricky, huh? Ok, déjame aspirar. No. Okay, ahora sí. So now I am inside. It's difficult, huh? You need to evaluate when you are inside or not, huh? Now I am inside, perfect. So dame contraste. Me das un coil de 10 y me preparas las ampollas. Uno de 12 entonces. Listo, ese está bien. Okay, so now I will put another coil. And now I will put the glue. So I don't have more 10 millimeter coil, so I am putting a 40 millimeter coil. So it doesn't matter because the coil is very flexible. So at the end it will be adapted to the vessel. So the most important is to be inside the vessel. Of course, we will not put a 20 millimeter coil with a very small lumen, right? But sometimes 2 millimeters more is okay. So perfect. And now I will pass the glue. Y pásame salina. Acá tengo salina. ¿Esto es salina? No. So now I will put the glue. Dale, ponle. Duro. Okay. And now I will flush with saline. Okay, perfect. So some vessels will stay, but it will disappear. Okay, we finish. Now we passed my gastroscope to see everything is well, and we finish, right? So ¿cómo? Al final lo revisamos. Quiero la imagen endoscópica. So now okay, bleeding could appear because I pass through the vessel, right? It's not something that you need to be worried. You need to see if the glue is okay and there is not more bleeding, right? So now I am doing my insufflation. I don't see more my gastric varice. It was here. Huh? Let me clean a little bit up. Pásame una pinza para pasar. Okay, ya no. Ya no, ya no. So here was the gastric varice. You see? There is no more vessel. So it's perfect now. So I do a triple treatment, right? And this is very important. We need to follow the vessels. This is the most important when we are doing this kind of technique. So you see here very well, I'm doing my insufflation and I don't see any more gastric varice. Let me remove this. Perfect. So there is no more gastric varice. It was a big one, but it's okay now. So now I am happy. The treatment was good, was successful, and this is what you can see when you see this kind of situation that the gastric varice disappear after the treatment. It means that you can be calm. 1 month after, you can do a gastroscopy just to see if everything is okay. But when it disappears, it means that the response will be very good, almost 90% of response after 5 years of follow-up, okay? After 8 years, huh? We have showed recently that, so now it's okay. Thank you so much, and Happy New Year. We will see you a little bit more with more cases.